Welcome back. I'm Ed Highland. This is the Big Ideas Theater at AARC Congress, and I'm joined now by Mark Yoder. Mark, thanks for coming by and joining us. Talking about lung transplantation and the RT. Give us some thoughts on, first of all, the subject material. Give us a concept of where you were going with that.
Sure. So lung transplantation is definitely a therapy, an option for many patients. It certainly is not right for most of them. But I think it's something that we have to keep in mind for our most severely ill patients with any and all respiratory diseases, probably most commonly COPD, cystic fibrosis, interstitial lung disease, and pulmonary hypertension, because those are the leading disease categories for which lung transplantation is performed and can be life-saving, life-prolonging, as well as improving quality of life.
Now, how can an RT, the RT, help the patient get ready for transplantation?
So I think one of the biggest things is kind of keeping that patient on track. Obviously, on the one hand, a person has to be quite ill in order to be the right candidate for lung transplantation, but on the other hand, you want that person to be as healthy as possible. So a respiratory therapy practitioner can certainly help, whether they're working in the pulmonary rehabilitation realm or can kind of funnel a patient towards that realm. That's very useful to keep their exercise tolerance as high as possible prior to going through a very complicated surgery and recovery period. In addition, they can kind of keep them on track with making appointments, maybe get them hooked up with a support group, and I think those would be kind of on the beginning side where they can help getting the patient to transplant.
So, got to transplant, now you've got post-surgical issues going on. How can the RT be of assistance there?
Absolutely. Once the patient gets out of the hospital, there's going to be a lot of monitoring that's going on. One of the big components of that is going to be spirometry. So FEV1 and FVC, really looking for signs of chronic rejection or maybe signs of infection or acute rejection. But chronic rejection, unfortunately, is a problem for which the medical field has not yet figured out a solution, and it's quite common. About 50% of patients by year 5 after a transplant have that problem. That's going to be picked up by a decrease in FEV1 from the best post-transplant level. And then there's also a restrictive process that can occur as a manifestation of chronic rejection, which is going to be picked up by a decrease in the FVC.
It's one of the things that's always amazed me about working with AARC is the close relationship that RTs have with their patients. Probably closer than just about any other medical person that the respiratory patient has. And so you're a friend. You're also their guidance along the way. So it's an involvement on the RT's part. I mean, talk a little bit about taking care of the patient, getting them prepared, because they're going through a tremendous mental episode here of transplantation. I mean, that's a whole thing. You're taking another person's lungs who lost their life for whatever reason. So there's all these elements that are going into, and psychology is not usually a part of the RT background, but you have to have that as well.
No, I think so, and I think you're absolutely right. I think the RT may end up spending more time with the patient pre-transplant than their physician might. And I think there's a lot of elements. The psychological is definitely a part of it. A lot of patients are coming in with an element of anxiety and depression to begin with because of their chronic lung disease, and then now they're faced with this other huge life-changing decision that they have to make, whether to go through with or not go through with a lung transplant. What are the options if they don't go through with it? And one of the things that a lot of patients kind of come off the list for is just really they become ambivalent. They question their decision about whether to continue with that process, because the pre-transplant process is fairly difficult. There's a lot of testing involved, staying healthy, a lot of visits that they have to keep up with, and obviously there's a number of different supports that are helpful to the patient. Certainly their family support, their friends, but also the medical community that they interact with can also be really helpful in keeping them on track.
Yeah, the physical and mental preparation
Absolutely.
for such an event like this. Mark Yoder, thank you so much for coming by and sharing with us.
Thanks for the invitation.
This is the Big Ideas Theater at AARC Congress. I'm Ed Highland. Thanks for joining us.